5 years ago, Leanne Minicello's mental health deteriorated to the point where she worried she would lose custody of her daughter.
I was feeling terrible. I had suicidal thoughts and everything.
The now 45-year-old was diagnosed with ADHD and borderline personality disorder. Without provincially funded therapy, she's not sure she would be here.
I'm not the norm. I think about the children. I think about the parents and people who aren't able to get this help.
According to the Canadian Mental Health Association, the system is overwhelmed and wait lists are long.
We knew going into 2020 that the mental health system wasn't equipped to deal with the strain that was on it prior to the pandemic, and now has only become much worse.
Mental health should be a priority.
In August of last year, Justin Trudeau promised $4.5 billion to provinces and territories for the new mental health transfer, but no money, including the initial $875 million supposed to have been spent or budgeted by now, has materialized. Last week, the federal mental health and addictions minister faced tough questions about the promise.
The platform promised that money to have been spent right now, so that was a mistake.
There were concerns that the $5 billion in the bilateral agreements wasn't transparent and accountable for the money that was being spent.
In March, Ottawa announced $45 million to develop national standards to ensure that accountability. In an email to Global News, Bennett said they will formalize what Canadians can expect in terms of timeliness and quality of mental health services. But advocates say that's just a delay tactic.
Accommodations for people that need.
Diane Young lost her son to addiction and mental illness in 2013. 9 years later, she runs a not-for-profit treatment center in his name. Funding, she says, held her back for years.
It's frustrating, yes. It's sad, more than frustrating.
That the cost could continue to put Canadians' lives at risk. Jamie Morocker, Global News, Toronto.